As a physician who has spent decades caring for women's health and advancing preventive care, I want to take a moment to talk with you about an important, often overlooked issue that affects millions of women: cervical cancer. According to recent data from the World Health Organization in Vietnam, for every 100,000 women, 20 are diagnosed with cervical cancer, and 11 tragically lose their lives to it. These are not just numbers. They represent mothers, daughters, wives, sisters, lives cut short by a disease that is largely preventable when caught early. In a recent health talk, Dr. Nguyen Thi Tan Sin, Deputy Director of the Women's Health Center at Vina MedConnect, shared valuable insights about the early warning signs of cervical cancer. Her message is clear and urgent. Every woman who is sexually active is at risk. While this risk spans across ages, studies show that women over the age of 35, particularly those between 45 and 50 years old, face the highest likelihood of developing this disease. Now here's why this matters. Cervical cancer often progresses slowly and silently. Many women don't realize anything is wrong until the cancer has reached a more advanced stage. That's why it's so critical to know the early signs, get regular screenings, and speak with your healthcare provider if something doesn't feel right. Remember, your health is your greatest asset, and early detection can save lives. If you found this information helpful, please like and share this video. You never know who might benefit from it. Someone you love could be silently at risk. Let's spread awareness and empower each other to take charge of our health. What causes cervical cancer? Cervical cancer doesn't appear overnight. It develops quietly, often over many years. And it starts with something surprisingly common: a virus that most of us have already been exposed to. That virus is called human papillomavirus, or HPV. Now, here's what you need to know. HPV isn't rare. In fact, it's the most common sexually transmitted infection in the world. According to the CDC, nearly 80% of women and men will contract HPV at some point in their lives. Most won't even know they've had it, because in many cases, the body's immune system clears the virus naturally without any symptoms. But here's where it becomes dangerous. There are over 100 types of HPV, and while most are harmless, a handful of high-risk strains, particularly HPV types 16 and 18, can cause abnormal changes in the cells lining a woman's cervix. These cellular changes, left untreated, can evolve into precancerous lesions and eventually invasive cervical cancer. And because HPV is spread through sexual contact, the risk begins as soon as a woman becomes sexually active. This isn't about promiscuity. This is about biology. Even women in monogamous relationships or those with just one lifetime partner can be exposed. That's why regular screening is so important. Cervical cancer doesn't give loud warnings at first. It whispers. And often, by the time symptoms appear, the disease may have already progressed. But with modern medical tools, we can detect those whispers early. Knowing the root cause, HPV, and how it leads to cervical cancer gives us power. Power to prevent, to screen, and to intervene early before it ever becomes life-threatening. This is why I urge every woman, especially those over 35, to talk to your doctor about HPV testing. Knowledge is not just power, it's protection. 7. Early warning signs of cervical cancer. One of the most challenging aspects of cervical cancer is that it often develops silently. In its earliest stages, it may not cause any discomfort at all. That's what makes it so dangerous, and why routine screening is critical. But sometimes the body does send signals. They may be subtle at first, easy to dismiss or confuse with other conditions. That's why I want to walk you through 7 warning signs you should never ignore. 1. Vaginal bleeding between periods. If you notice the spotting or unexpected bleeding when you're not on your period, don't brush it off. Irregular bleeding can be one of the first red flags of cervical changes. 2. Heavier or longer menstrual periods. A shift in your normal cycle, especially if your periods are suddenly longer or much heavier, could signal inflammation or abnormal tissue growth in the cervix. 3. Bleeding after intercourse. This is a particularly concerning symptom. Bleeding after intimacy may point to fragile or damaged cervical tissue, possibly caused by precancerous or cancerous changes. 4. Bleeding after menopause. Once a woman has reached menopause, any form of vaginal bleeding is not normal and should always be evaluated immediately. It may be an early sign of cervical or uterine abnormalities. 5. Unusual vaginal discharge. Pay attention to any changes in your discharge, especially if it becomes foul-smelling, watery, bloody, or unusually thick. Discharge can often be the body's first cry for help. 6. Pain during intercourse. Sex should never be painful. If you're experiencing discomfort or sharp pain during intimacy, it might be more than just hormonal changes or dryness. It could be a sign of cervical inflammation or tumors. 7. Persistent pelvic or lower abdominal pain. Chronic pain in your pelvic region, especially if it's dull, aching, or doesn't go away, shouldn't be ignored. It could signal underlying issues in the reproductive organs. Even just one of these symptoms doesn't mean you have cancer, but it does mean you should talk to your doctor. The earlier we investigate, the earlier we can act. Why early screening is a lifesaver. Let me be clear, cervical cancer is one of the most preventable cancers in the world today. And the key to prevention lies in one word: screening. For many years, the Pap smear has been the gold standard for detecting abnormal cells in the cervix, and while it has saved countless lives, it's not perfect. Studies have shown that Pap tests can miss up to 50% of cervical precancers, especially in early stages when symptoms are still silent. But here's the good news. We now have a more accurate and powerful tool: HPV DNA testing. The HPV test looks directly for the presence of high-risk strains of the human papillomavirus, those most likely to cause cervical cancer. When combined with a Pap smear, this approach offers up to 95% accuracy in identifying women at risk. That's an enormous step forward in women's health. In fact, research shows that women who undergo routine HPV screening have significantly lower rates of advanced cervical cancer and death compared to those who don't get screened. And yet, many women, especially those over 40, skip these crucial checkups. Sometimes it's fear, sometimes it's lack of time, and other times it's simply not knowing how important this test is. So if you're a woman over 35, or you haven't had a recent cervical screening, I strongly urge you to speak with your healthcare provider. A few minutes of screening can add years to your life. Treatment options, and the power of early action. If you or someone you love is diagnosed with cervical cancer, I want you to know this: you are not alone, and there are effective treatments available. Modern medicine offers a range of therapies that can be used individually or in combination, depending on how far the disease has progressed and the patient's overall health. Here are the most commonly used treatments for cervical cancer today. 1. Surgery. In early-stage cases, surgery may involve removing part of the cervix, or in some cases, a full hysterectomy. For many women, this can be a curative treatment, especially when the cancer is detected early. 2. Radiation therapy. This uses targeted beams of energy to destroy cancer cells. It's often combined with other treatments and is highly effective at controlling or reducing tumor growth. 3. Chemotherapy. Chemotherapy is used to kill cancer cells throughout the body and may be administered before or after surgery or alongside radiation, particularly in more advanced stages. 4. Immunotherapy. This newer approach helps your immune system recognize and fight cancer more effectively. It's becoming increasingly valuable, especially in advanced or recurrent cases. 5. Targeted therapy. Unlike traditional chemotherapy, targeted therapy focuses on specific molecules involved in cancer growth, offering a more personalized and potentially less toxic treatment option. Treatment decisions are never one-size-fits-all. They're based on many factors: the cancer stage, your age, your overall health, and your personal preferences. The earlier the cancer is found, the more options and better outcomes you'll have. Final thoughts and a message from the heart. As a physician, I've seen what happens when cancer is caught too late and what's possible when it's caught in time. Cervical cancer doesn't need to be a silent killer. We have the tools to detect it early. We have vaccines to prevent it. We have treatments that work. But what we need most is awareness, and that begins with you. So I encourage you, stay informed, talk to your doctor, schedule your screenings, listen to your body. If this message has helped you in any way, please like this video and share it with someone you care about. You never know whose life you might save just by spreading this knowledge. And don't forget to subscribe to the channel for more health tips, updates, and stories that matter, because your health is worth protecting. Thank you for watching, and be well. Dr. Kim, Vina MedConnect.